This episode of the Beauty Industry Podcast was brought to you by Aesthetics RX. Hello and welcome to the Beauty Industry Podcast, your online support community for the professional beauty industry. I am your host, founding director of Beauty Industry, Tamara Reid. Here, we are closing the competitive gap and speaking your language. This is a platform created and dedicated to the professional beauty industry, valuing community over competition. We serve to help connect you with inspiration from industry experts, expand your knowledge through educational pieces, and bring you the latest in product and technology innovation. This is Beauty Industry. Today, my guests are Caylynn Jagga and Emily Fenton from Skinfluence Clinic. We often hear about referring on to other specialists to stay within our scope of practice and increase client satisfaction. But what if those said specialists were all under the same roof working collaboratively? Well, if you've ever wondered how collaboration in a clinical setting works, then today's episode is going to tell you exactly that answer. Emily has a Master in Nurse Practitioner Studies with a specialist interest area of dermatology. And after extensive training working under some of Queensland's and even the world's most well-known medical procedural dermatologists, Emily established Skinfluence Clinic. Working alongside Emily is Caylynn Jagga, who you may remember from our previous episode on Dermal Therapists and Clinicians. Caylynn began in the beauty industry back in 2014 after suffering acne herself and, in search of something more, came across the Bachelor of Health Science in Dermal Therapies with Victoria University. Caylynn continued to further her studies by undertaking courses in skin cancer and dermoscopy, and she believes skin health is multifaceted. Today, Emily and Caylynn join us to share how dermatologists, dermal clinicians and therapists and other healthcare professionals working in synergy together can create greater outcomes for their patients. As you guys know, community and collaboration are topics that are very close to Beauty's heart, so we are thrilled to talk to these two incredible ladies today. Here's Caylynn, Emily and I for Beauty Industry. Emily and Caylynn, welcome to the Beauty Industry Podcast.
Thank you so much for having us. We're looking forward to speaking to all of our industry peers and how we can all work closer together.
Yeah, thank you. It's been a while since I've had two people on a conversation, so I feel like this is a beautiful way to start a Monday morning, chat between friends over a coffee and over Zoom, obviously, because COVID pandemic life is still very real, as we all know. We're all in Brisbane, and so we have just come out of the lockdown ourselves, right? How did you guys go with that?
Yeah, testing, I'd go to say.
Always, yeah.
Like, I think everybody in the industry finds that you just kind of like got to roll with the punches and turn up when we can turn up and change paths when we can, and I don't know, get out stronger on the other side, I think is the big thing.
Yes, keep going.
Yeah, absolutely. Lots and lots of lessons learnt this year and last year. And Caylynn, I need to say welcome back, because you have featured on the podcast before. Any loyal podcast listeners will know that we chatted to you and also Brooke about being a dermal clinician versus being a dermal therapist and that kind of career pathway. So good to chat to you again.
Thanks for having us back, or me back. It's exciting. I'm looking forward to it.
It is exciting. So, Emily, I might start with you. We generally go all the way back to our guest beginnings of their career, because I think it's not spoken about, how people get to the level of success that they've got to, whatever that may look like. And I'm always interested to know, where did your industry career start? So let's go back there for a moment.
Okay, big rewind, but I guess I'm a little bit different into how I did end up in, I'm going to say, the aesthetic industry, in that when I graduated from uni, sort of 12, 13 years ago, it wasn't, dermatology wasn't a big thing, but people didn't really know what it was. When I graduated, people were like, oh, you're going into private practice, that's a bit scary. So I pretty much graduated from my nursing degree and then went straight into private practice, into dermatology. I was lucky enough to work for one of Queensland's largest sort of medical and also procedural dermatology clinics. in nursing, they don't really talk about skin as such. We do wound care, which is a very big thing, but skin gets very much forgotten. So then when I started working in private practice, I then found there was so much to learn, and that most, I'm going to say, even medical conditions can present as a skin concern first, or they work or not work together, but you can learn a little bit more about how the body's functioning because of a skin presentation. So I thought that was pretty cool, and then learned that then you can do more procedural stuff. So there was things like chemical peels, and there were lasers, and there were, sort of lesion removals. There was so much to learn as well. So it was pretty cool, but I learned more on the job than any formal education. So I didn't do any, I've just done my nursing degree, and I have also done my master's in Nurse Practitioner Studies, but I never did a course as such after I graduated. So yeah.
Interesting. I think skin's kind of like Pandora's box, right? You kind of start with the wound, and then you go, oh my goodness, and the wound needs collagen to reknit, and then you go to collagen, you go age management, you go, reactive oxygen species, you go down that kind of pathway, and then you're like, oh my goodness, how did I end up here? And I'm obsessed. Did you find that you were kind of like that?
Pretty much. I think it was each level that I started to learn more about. I was like, whoa. And that one thing, it's not just one, it's 20 different things that you need to learn to know that one thing to begin with. So it is a case of that when you start even researching or reading through a textbook, you end up losing track where you started off, and you're like, I'm not sure how I even got here.
Absolutely. And so then where did the idea seed into your kind of career pathway? Did you always want to open your own skin clinic, or how did that kind of come about?
To be honest, opening a skin clinic wasn't on my radar to begin with. It was something that I was very fortunate sort of a year and a half, 2 years ago, to be presented with the idea of doing it. Nurses don't tend to open up their own clinics or, do their own thing. We tend to work very closely with doctors, but I still do work with quite a number of different, I'm going to say, specialties in the medicine world, but opening up my own clinic then became pretty exciting once the idea got into my head, that I then, tried to do a lot of research before I did jump into the deep end. But it did take a little while to kickstart because of COVID. We started, and then we stopped, and then we started again, and then we stopped again, and then we started, and then we've kept going. So that's exciting.
Amazing. I love how you said that you did a lot of research before diving into it, because I think typically these days, like, it's so easy to just open up an Instagram, buy a business name on ASIC, and then all of a sudden you've technically got a business, and I think a lot of people do the research after and then go, oh my God, what's a target market? How do I get clients? What are the procedures? What are the policies? So I appreciate that you did the hard work beforehand. So then you're like, okay, wholeheartedly, it's still a yes for me. I still want to open this.
Yeah. No, I completely agree. I don't know, I think the research part was probably a very fun part of it, trying to research what we wanted, who we would, I guess, see in our clinic, because we're a little bit different. But I was lucky enough to have Caylynn pretty much on the journey since the start. So we worked together pretty closely. During COVID last year, it was a lot of Zooms. We would talk to each other over Zoom, and get ideas and bounce them off each other and be like, this is what we want. Yeah, this is it. Let's go. Yeah. So
very cool. And Caylynn, obviously we know that you are a dermal clinician. We've heard your career pathway and, so much passion through there. How did you then go from doing all of that kind of work and finishing your studies into working in a skin clinic now with a nurse in kind of the dermatology area?
Yeah, so it's been a bit of a journey, but I have always just loved the science. I just want more, the why, tell me more all the time. So I wanted to align myself in that medical, I guess, dermatology clinic. I wanted to see all the skin conditions I could possibly see. So I guess after a bit of persistence and trying my best to try and get into a dermatology clinic, where I guess just as a dermal clinician, you're still not really you're not really well recognized. They're still like, what's that? So it was a bit tricky, but we got there in the end. And I was really fortunate enough to meet Emily and lots of other nurses there, who were open enough to hear what we learn and what we study. And they kind of were a little bit, they guided me through it a little bit too, which was exciting. So I've now learned more about what a nurse practitioner is, because similarly, like with dermal clinician, it's like this not as well-known field. So Emily kind of understands as well in a different way, but same at the same time. And she's been able to help me open up my scope in a way, because we can work so closely together. So I highly encourage other dermal clinicians, if they enjoy it, the medical side of things as well. You can, align yourself in dermatology or find a nurse practitioner, because there are out there. They're just not as many around, just like dermals. So, yeah.
Yeah, very cool. You touched there on something that I think probably our industry as a whole needs to dig a little bit deeper and get some more clarity on, because it's very muddy. All of the names and the qualifications or the not qualifications. I think there was a name, some kind of thread in our Facebook community the other day, which was like, I call myself a holistic skin practitioner. What do you call yourself? And I think apart from like beauty therapist, dermal clinician, which are actual qualifications, there are kind of just like names being thrown out there. Well, I'm holistic because I believe in the gut, or, well, I'm a clinical facialist because I put gloves on and do my facials. I think all of these kind of names, they're just made up. And I think we need a lot more clarity on that, which, as you're saying, it's difficult for a nurse to know what your actual scope is. But that's even more confusing for clients to know as well. Like if I call myself one name and you call yourself another, but we've both just got the beauty therapist diploma, there's a lot of confusion out there. I could go on for days.
Oh, absolutely. Yeah. We agree. Definitely.
We get it on a daily basis.
Every day. Yeah.
Because people will even suggest to me, because I treat skin, they will go, oh, so you're a beauty therapist? I'm like, no, actually I'm a nurse practitioner. But then they think that I'm just a nurse, because then I'm a practicing nurse. They don't understand that title. And then I introduce Caylynn. I'm like, Kaylynn's a dermal clinician. And then that gets confusing because people haven't heard of that title before. It's
just education. That's the biggest thing. We're constantly on repeat. But hopefully the more times we repeat it, the more people will know. And then, we'll get there.
Absolutely. There's a lot of work to be done. Emily, I am interested, when you first started Skinfluence, did you always want to have a team of dermal therapists and people who specialized in skin under your umbrella?
Absolutely. When I first, to rewind it back a little bit further, I had a dermal clinician years ago approach me when I was working at the Dermatology clinic to come in for work experience. And I didn't know what the title was. I didn't know what a dermal clinician was. And she just kept emailing me going like, please, I'd just like to come in for work experience. And I was like, oh, okay, fine, come on in. So she came in, and then I got to then learn what a dermal clinician was. And she's like, oh, we pretty much go to uni for 4 years and just study skin. We learn physics of lasers, we learn cosmetic chemistry, we learn, how other things interact with the skin. And my brain just went, wow, like what a cool sort of, I'm going to say, career path or degree that, she sort of took. And then that's then when I learned a little bit more about dermal clinicians and thought, I think they're actually a fundamental role to have within a clinic. And I think we all work very well together. So, dermal clinicians tend to know like what I just mentioned, whereas nursing, we learn more the medical components behind it. But then collectively, when we work together, we then kind of, I don't know, our brains just go like bang, and we can come up with some really cool, I'm going to say, treatment plans for patients. And I don't know, we just work very well together. So after I saw that, I was like, nah, I need dermal clinicians. They have to be here.
After the break, we get down into the nitty-gritty of how the collaboration between nurse and therapist works on a practical level. But first, a word from today's beauty partner. Community, I need to let you know that Aesthetics RX is an Australian vegan cosmeceutical brand with powerful formulations made with biotechnology and enriched botanicals that we are loving at the moment. Their range of retail and professional clinical skincare is effective, safe and cruelty-free, and their formulation charter bans the use of questionable ingredients like parabens, sulfates, and any ingredients derived or tested on animals. Aesthetics RX incredible retail line supports a range of clinical peels with pre and post home care that enhances your clients' results. Opening orders are completely customizable to your business because they know flexibility and personalization is the key to your success. For a limited time only, you can receive $1,000 worth of retail products wholesale value with your professional peels opening order pack by quoting Beauté1000 on your inquiry. Make an inquiry today to see if your business qualifies at www.aestheticsrx.com.au/become a stockist. Thank you so much to the team at Aesthetics RX for making today's episode of the Beauty Industry Podcast possible. And now, back to Emily and Caylynn. Yeah, absolutely. And that work, how you're saying you work together, what does that practically look like? Because I think a lot of nurses want to work with the therapist and a lot of therapists want to work with the nurse, but then they're like, who's doing the treatment? Who's chatting to the client? Like, what does that actually look like in an appointment book, if I can be a little bit nosy?
I guess patients will book in with, I guess, who they align with. I don't know, kind of, they might see our presence on social media or look at our website and be like, no, I want to go see a nurse, or no, I want to go see a dermal clinician. So they'll book in with who they choose. And then we at least let whoever they've booked in with first, they do the initial consultation, they'll talk to the patient, they'll find out why they're there for that day. And then pretty much once we get to the nitty gritty, then we kind of go, do you mind if I introduce you to Caylynn? Kaylynn's a dermal clinician, or Caylynn will go, hey, can I introduce you to Emily, our nurse practitioner? And then we kind of then sit down there with the patient and be able to like brainstorm while the patient's in front of us. And to be honest, they love it.
They do. They love the teamwork. Yeah. Like another example, I guess, that happens quite often is, so maybe a melasma patient might come in and I might see them first and I'll educate them on melasma and sort of the approach you can take. And so they are well educated on what their skin condition is. And then I might suggest sort of things I can do. So some peels, maybe lasers. It just depends on how it's presenting. But then they also need to do things at home. And that's where we think, well, where I recruit Emily. And I'm like, okay, Emily, can you come through? And then I'll introduce Emily, like she said before, and she'll prescribe some topical things to do, potentially oral if needed, for various skin conditions. And then that's how we'll work together. So it's not a case of like Emily then now takes the patient and has them as her own and treats. We work always together. Emily will maybe be with them for a little while and then pass them back to me, and then vice versa. So it's a real team approach, and we really all thrive off that a lot. I think that's what makes us, I feel like, unique, and it's fun. It's really fun.
Yeah, it would be.
We also have an in-house dermatologist as well. So he fits into the picture as well, because similarly, he'll prescribe patients medications, and then they want to know a little bit more about skincare. So then we kind of go, oh, we'll take that part back. We talk to the patients about that, or treatments or whatever, just so that the patient can be as educated as they possibly can be before they leave.
Yeah, it sounds like a beautiful collaborative approach. I think in the past, there's been a lot of like competition. Oh, the nurse is going to steal my client, or the dermatologist is going to steal my client, or, they're going to say something that I don't believe in. But I think, if you're all sharing the same values and you're all under the same roof, it certainly makes that partnership much easier, doesn't it?
Yep,
so
absolutely.
True. There's so much, there's room for us all. There really is. We all have a part to play, and I've been learning that more and more over the last few years.
Yeah, for sure. I, when I was an educator, used to travel around and go into day spas and actually sit in the treatment room with the therapist. And I would just have on a uniform, and I would pretend that I was just a therapist as well. And I would give the client a little hand massage and a foot massage. And the therapist would always be like, oh, my client's not going to like you coming into the room. I would want to listen to the consultations and the prescriptions and the education, just to make sure that, the client was getting the absolute best service for them on the bed today. And the therapist was always very hesitant about having me in the room, but the clients loved it. They felt like this $1 million client, 2 therapists, 1 treatment room. Like, they just thought that it was just this next level of exceptional service. So I think we have sometimes a lot of fears around, what we don't know, but I would encourage anyone to listen. Like, it sounds like you guys have hit the success and hit that jackpot. Well, then, why not try something out of the box?
Yeah.
Yeah. You don't realize, you don't know what you don't know, really. And it actually works, like both scopes can be increased a little bit. Like as a dermal, I feel like my scope's increased because I don't have to send someone to a GP if they have to go, or like outside of the clinic. I'm like, okay, well, actually Emily can do this, so I'll pass you to Emily. And then it's still that teamwork. So,
and I think people will like explain different things in different ways.
Yeah.
So Caylynn might explain how to, apply cream this way. And then I kind of go like, well, that's a really good way of explaining it. Maybe I'll try use that for my patients. And then you find that they're more compliant with their therapies because you've changed your delivery. I think that works really well too, because every time, it doesn't matter if it's Caylynn or, listening to a podcast or listening to, the doctors speak or everybody kind of keeps adding to what you can then add to your patient care. So I think by having, somebody else in the room, it also means that you're continuing like to deliver a, optimal service, because you're kind of kept on your toes because you're like, oh, someone else is listening. I better, be good today. So
true.
Yeah, absolutely. It's kind of like in school where you're watching someone else do a facial technique or you're watching someone else do a massage technique and you go, oh my God, what are they doing? And then you kind of try it out yourself. Like, it's constantly learning, isn't it?
Yeah, because I think too, being a nurse, we're not taught any of those techniques ever. So even when I watch Caylynn, or if she's doing a treatment on me, I'm like, oh, I'll try that for myself and see if my patients like it. So I think that's good as well.
Yeah, absolutely. And Emily, I'm interested to know then, as you said, you've got some dermatologists and you also refer to plastic surgeons and the like. How did you then find these people? Because, we want the best of the best in our business. And then how do you kind of get that relationship started and say, hey, do you want to work together with me? Because that can be sometimes awkward as well and scary.
I'm going to say persistence is probably the biggest part, and not being scared to reach out to your colleagues, because like we've already kept saying, is that they may not have the scope of skin. They may be more medical and we do a little bit of both. So, even reaching out to some of our local plastic surgeons, it's like at the end of the day, they want the best for their patients. We want the best for our patients. So we're kind of like, if we can work together, we can keep making sure that we're giving a very high level of service. They don't have to, like you said, they're not always going to be your patients. There's no ownership. It's like collectively, if we can all continue to work together, we can continue to, get the best out of, the industry. There's, as Caylynn said, there's room for all of us. So it's just learning how can we all work together to get, the best, I think.
We're adding. It's always about adding, like you're adding to the outcomes of that plastic surgery's patients' results,
And I think social media now has, a good space that you can just, I hate saying this, but slide into the DMs and, be like, oh, I like your work. And it just has to be a couple of times of that. And then you kind of go like, hi, my name's Emily and I'd love to work together. And they're like, oh, okay, cool. Yeah, we know who you are because we've looked at your social media and, we've followed you and we've given you some likes. And I think that makes it a little bit easier now that it's, I'm going to say, less formal, having to meet people. They can do it a little bit, backwards. And then, or you could send them an email or pop into their clinic and be like, how can we do this? Like, but persistence is probably the big thing.
Yeah, absolutely. I love that. And I've actually had a recent example of this slide into our DMs. So I consistently had this beautiful woman, Marianne, come into our emails. Hey, Tamara, love what you're doing at Beauty. Can I please work with you? Want to do some hours, want to do some intern. And I was like, no. Don't want to touch intern with a 10-foot pole. I don't know how to navigate this situation. It was just another thing on my plate. I was pregnant at the time. I was like, oh my goodness, this is too much. And she consistently emailed, hey, checking in, making sure you got it, really keen to work with you, keen to intern. And I think after about the 5th email, I said to my brand manager, set up a call with her. Let's just have a chat. Let's see how it goes. And we got on a call. She is studying at Vic Uni, Dermal Therapy, absolute bomb therapist, like so good that I could not refuse. I was like, I don't we don't do interns. We don't have interns here at Beauté, but I need to make you an intern. I need to create a position for you. And so we did. So she's doing 3 months with us. It's fantastic. She's created lots of content for us. She's helping other therapists answer questions, and since then, so many more people are going, oh my goodness, do you have an intern program? I'm going, oh, maybe this is now something I have to start, But I think if she didn't come into our email and be so persistent on Instagram and bits and pieces, I would have never opened up, intern spaces or anything like that. So I love that you say persistence, because while you may feel annoying, it pays off, let me tell you.
That story that you've just told, I'm literally just sitting here going, this was the dermal clinician that emailed me constantly that didn't give up. Literally, she didn't give up. And now, she's
opened the door for us.
Yeah.
Yeah, she has.
Amazing. Very, very cool. I think there's a lot of people who are going to be listening to this episode going, I want to do what they're doing. And what's your advice on where to start? This kind of integrative, collaborative practice, I think, is definitely the way of the future. I mean, even looking at places like, co-sharing spaces, and you've got hair and you've got skin and you've got inject and you've got cosmetic and you've got dermatology all under the one roof, is a very, very cool idea. Where do they start?
Well, I think just first, really think about where you want to align yourself. Because the industry is so big, is it plastics? Is it dermatology? Is it spa, or whatever it is? Really know what you want first, and then maybe start with that persistence and keep going, keep persisting until you find there will be someone that will open the door for you. But don't be shy. But I think first starting, finding out what you want to align yourself with, because if there's a lot, and whilst it's all the same industry, plastics and dermatology, I'm just using them as examples, are so different too. So, that's what I think.
I don't know. I think it's a little bit tricky, because it's until you find that right, I'm going to say person or role, or that it might take a lot of time. It might not be as quick, because rewinding me back to the sort of dermal clinician, that was sort of, I think, 4 or 5 years ago. So it's taken me 4 or 5 years to get here with really accepting them as a role. You kind of going, oh, I don't know how this works and I don't know how this is going to fit. So time probably is a big thing. Nothing should be rushed, I think, because that is, like you said before, people don't research and they just oh, everybody come into my clinic, and then they kind of go, oh, okay, we've got too much in our clinic. Whereas I think focusing on what you're good at and staying in your lane to begin with, and then you can expand from that, I think is probably, I don't know, maybe my little bit of advice.
Yeah. It's interesting though that you both say, in the same breath almost, work collaboratively so that we can open more services almost, but still you're hanging on to the niche. So you guys aren't going, oh well, let's just get spa therapists in here, let's get beauty therapists in here as well. You're still very much skin, though you are open to dermal clinicians and dermal therapists and dermatology, which I think is really interesting, because once you kind of open that umbrella of collaborative working, it can get too much too fast.
Yep.
Really knowing what you want, then
Yeah, absolutely. So I'm interested to dig into some of the challenges that you guys have seen along the way. Obviously, COVID is the big elephant in the room. I mean, starting a clinic during COVID is, one thing, and then being able to survive it, though we aren't on the other side. I mean, who knows what that will look like. But what have been some of the more challenging points for you both?
I would go to say, apart from COVID, we opened our clinic in a new area that neither of us had actually ever worked in before. So previously I worked in the western suburbs of Brisbane, so did Caylynn, and then she also worked in the eastern suburbs. So now we're Bayside. So we had to start from scratch. We had no patient lists, no one to call on. Yes, our first patients were friends and family that were come in and tell everybody, what we do. So that was, I'm going to say, our greatest challenge. But now that people have learned what we're doing, they love what the service we do. I guess, prescribe, because we spend a lot of time educating. That's why we're here. We just want people to know what they can do. I describe my part of the role in the patient's journey is that I'm like a PT, that I can give you all the education, I can give you the tools, but if you don't do the healthy eating and the walks around the block, which is their skin care at home, they're not going to get to the same position as somebody who does all the right things. So I guess that's probably our biggest challenge. Well, what I think is our biggest challenge was starting from scratch. But,
and then in the new area, and also kind of bringing a new dynamic to the industry, this collaboration, but all in under the one roof type thing, because there might not always be under the one roof type situation going on, which is fine, but it's just new kind of area in a way.
It's breaking that barrier, isn't it? When you do something new and you're the first one there, it's very difficult. Like you feel like you're banging your head against the wall because you consistently have to tell people the same thing for like 3 to 5 years until finally someone goes, oh my goodness, I get it.
So true.
Yeah. So I'm interested to know, actually, you guys are only around the corner from me. I'm going to have to come and visit you.
Yeah.
I'll mystery shop you.
Okay. But we know what you look like.
Yeah, we do.
My name is Svetlana.
Tomorrow.
So tell me then, knowing what you know now about opening a clinic in a new space and, you know, being collaborative, would you change anything if you had to do it all again tomorrow?
I don't think so. No.
Especially because you did that research. And I think we also should say we did work together at a previous, so it is a little bit unique. We did work together in the past. So we already knew how we worked together.
Great.
Yeah, that's a little bit easier, but
no,
not particularly.
No, we've been lucky because, like Caylynn said, we worked together. So I knew how Caylynn worked. So I knew how I could like slip in and help her patients. And I knew that she wouldn't mind if I came out of my consult and was like, hey, can you come in here and, you know, help me with this, or this patient's struggling for this, or, you know, afterwards, you know, we always debrief about our patients. That's probably a big thing that we do as well here in the clinic, is that it's, you know, we pull out our photos and we pull up our notes and everyone kind of collaborates again after the patient's left, so that then when they come back the next time that we're like, oh, we can add even more to your journey. So no, I don't think I would change anything.
Not particularly. Is there anything that we could give some advice on?
Yeah, definitely.
I guess the whole slow and steady wins the race comes into this, maybe because Emily did have all this time essentially to really research and really dotted all her I's and crossed all her T's, and it didn't just jump in. So maybe just not jumping in is really worth it in the long run.
Because I guess from idea to completion, it was pretty much like, I'm going to say 9-10 months. From me going like, yep, let's do this, to then it actually being the case. And I guess don't get disheartened when you start off and you've only got a couple of patients, because if you can deliver the care to those patients with a smile and, you know, passion and as much sort of profession as you can, that's what the patients love and that's what they come back for. So I think don't be disheartened if you start and you've like, oh no, we've only got one patient today.
It's okay.
Give that patient the day's worth of care and be like, just nail it on the head for that one person, because then that one person will turn into 2 people and that 2 people turn into 4 people and the cascade keeps going. So
very true.
That's great advice. That is good advice. And, you know, even when I think about lists, which businesses have had in the past, like 3,000, 5,000, 10,000 people on their list, you still get those same regular people coming back. Like you're not seeing 3,000 people. You're not seeing everyone on your list. You generally see like your top 50 clients who are consistently returning, you know, and it's those clients who you give your well to, who tell the rest of the people. So I think, that's a good piece of gold there is, you know, not to worry about if your appointment book is not completely full. I mean, yes, you need to put food on the table at the end of the day, but you will get there.
Quality over quantity. Definitely.
Absolutely. Well, ladies, thank you so much for spending the morning with me. It's been so good to have a chat with you and get to know you both a little bit more intimately. And I shall absolutely come visit your clinic.
Please do. Thanks for having us. We've really enjoyed this podcast today. Thanks, Tamara.
Collaboration is the key. Need I say it more? I think by now, if you've listened to this podcast for a while, then you already know that. The way of the future, if I can sound a little bit dorky, is by working together, and I absolutely love hearing from great businesses who are doing that well. The biggest point that I took away from today's conversation is that in order for a successful collaboration to take place, you should stay in your lane and get people who complement your services to align with your business values, and then share your clients mutually for the best outcome. If you would like to know more about collaborations, or maybe you want to share how you're listening to this episode, then you can give the ladies at Skinfluence a shout out on your stories, or even slide into their DMs by searching for them on the gram at Skinfluence Clinic. Us, of course, well, we are over at Beauty Industry and myself at Tamara Reid Beauty. If you want to continue to support the show and these important conversations, please tell an industry teammate, boss, or even your rep about this podcast, because the more people who listen to the episodes means the more people our industry can start to be open to and have these important opportunities like the ones spoken about today. Thank you for your ears and your time as always. Until next time, stay connected.